please get it to me. I don't know what it would be. I think we're fine, but I'm just letting you know that we got a checklist on your file, and if that checklist is complete, then you get a course completion certificate. So one of those checked items is you passed the capstone exam.
That's the big last
That's
one.
the big last one. That's the big last one.
On the 3rd? Is that on the last day of class?
I haven't set that date yet. It'll probably be early enough to where if you got it, you can relax. If you don't have it, we can still get it. You can get the retest knocked out before the semester's over. Yeah, we have next week, which will be a big review and test. We'll need a test next week over trauma. We'll take our Thanksgiving break. That was unlocked.
How many tests do we have left? We have trauma?
2. No. 3 if you count the capstone. 3 if you count the capstone. So we're going to get in a testing, question answering, review mode here after today.
Okay, cool.
So we need to get geriatrics knocked out. There is something I have to do at 11, so we're going to get this done. We probably won't take our break. We'll probably just push through. If you get the sudden urge to go, do so. I hate to be personal here, but if I get the sudden urge, I may dip out myself because I had a burger yesterday that I think had E. coli in it. And so I've been up most of the night. I'm slightly dehydrated, I can tell. My tongue's dry and I'm chilled.
Where'd you get it from?
Here.
Oh, no. There's your problem.
Here. I'll just go ahead and say it. I got it from here, Frank. So did anybody else eat a burger yesterday? Maybe that's where they're at. I don't know. I only ate 2 things yesterday, and I communed with somebody else on my final meal, and that person's fine. So I'm pretty much know where it was at. You know when you take that first bite and you're like, I've had better burgers. Okay, so not to be personal, but if I get the urge to go, you will want me to. So I don't think that's going to happen. It's been a little bit. It's been a good 10 minutes. All right, geriatrics. So statistically speaking, geriatrics or centurions, those people over 100, is the fastest growing segment of the population. Now, when I first heard that and talked to other people about it and I read about it, everybody's applauding that. What does that mean to society? If people over 100 are the fastest growing segment of the population, what's that mean for society? People live longer.
People aren't getting bored enough.
People aren't dying.
People aren't dying, they live longer. So we've already had the discussion about health span versus lifespan. And in my experience, if you're living over 100, you're pretty damn healthy. The 100-year-old people that I messed with in the field were pretty much with it, not what I would expect. So there is something to say you're going over that. You start really digging in the statistics, it's not that it's necessarily the fastest growing segment of the population, but statistically speaking, the newborns, the children are the fastest declining segment of the population. So it's an offset. Depending on how you graph it, how do you want to look at this? They're fastest growing because this is the fastest slowing segment. So our birth rate in the United States is way down, way down. Like if it continues this, we will not replace ourselves. That's how bad it is. And they project out how long that's going to be. Everybody called Elon Musk crazy when he said, have more kids. No, he's just looking at that from an analytical point of view. We are in a decline when it comes to that. So you also have worked, and I'm hearing feedback from you in your clinical experience. Well, this is all we do. This is all we do is geriatrics. You live in a retirement community. That in itself is changing, though. So we have a lot of workers coming in to the chip manufacturing and all the things going on around here. So maybe percentage-wise that will decrease. Secondary to that, though, geriatrics get in trouble. So let's go down a laundry list as I flip through the competencies. Don't worry about writing these down. Worry about having a conversation with me. Let's talk about why they are your number one call, other than there's just a bunch of them. What specifically? You're right. You're 100% right. They are high risk. Why? And that's the gist. Weakness. Mental diseases. The horsemen are there, right? Dementia is there.
So there's less.
What'd you say, Jordan?
A lot of them are on like blood thinners, so they're followers.
Okay, so there's a term here. If you don't know this term, it wouldn't be a bad idea to know it, called polypharmacy. Polypharmacy. Polypharmacy is a concept where these people go to so many different doctors and get so many different prescriptions. And if you've been around them in your clinical experience, can I have a list of your meds? And they hand you a book. You know, it's like, here they all are. You used to want to take the med with you. It's like, you're taking, I'm just going to name one, something, I don't know. You're taking Zoloft. Let me grab the bottle of Zoloft, and that way it goes with you to the hospital and you won't have to buy it from the hospital. It's your prescription. You've already paid for it. Kind of a generous thing. Now when you go, it's like, I remember getting a Walmart sack. My partner I always joked about it. I said, can you say something else besides a Walmart sack? He said, well, hell, everybody's got one. Why not? You got a Walmart sack for these meds? And we were raking nightstand medications into a Walmart sack to take them with them. And it seems like today, you tell me, but you just get a list. You just get a list. And it's Macrobid, Q4D, and all these other things. It's like, how are these interacting with each other? Do you think the doctors know? The prescribing physicians? Do you think they know that you're taking something else from the doctor that's down the road, and now we have teledocs? I don't know if you've ever experienced that. You can just sit down with somebody and say, hey, I suffer from migraines. And they're like, okay, here's your migraine medication. You know they're not consulting. That's why your primary care physician is basically your coach, your health coach. They don't go to the primary, then go to the specialist. And then we'll combine all that back together, and I don't know. You're not in charge of it anymore. And these people get into that situation. Is there anything else?
Just less capable.
Just less capable in general? Are you expanding that to include financially, family support groups,
I am now.
housing? Are you considering that when you say they're less
They need help
capable?
if they're living on their own. Pretty much.
Yeah, I hope you're taking the social aspect when you say that, because we know they're less capable physically. I don't know, to some degree. I know some pretty strong and capable and athletic kind of older people.
Are like the most independent people.
Uh-huh.
They try to be so independent. They don't want your help at all.
So here's the word that fits that, Jordan. They do that because they fear a loss of autonomy. So the word's called autonomy, A-U-T-O-N-O-M-Y, autonomy. They fear of loss of autonomy. Can you define that? Anybody know what the word is? Means?
Basically, you take care of yourself.
Yeah, and if you lose that, somebody's going to take care of you. So they don't want somebody making those decisions for them. And the more they fear that, Jordan, the more stubborn they are about losing it. Yes, I can. You don't tell me you can't drive. Yes, I can. You can't. It's kind of sad though, isn't it? Because we all hope to be there someday, but we don't want to lose our autonomy. So just think about it right now. If somebody walked up and took your driver's license, and you're saying, "Why are you taking my driver's license?" I don't think you're safe anymore, Grandpa. You wouldn't want that. But yeah. Exactly. Loss of autonomy, they fear that. And then back to you, Frank. Can't take care of themselves financially, fixed incomes, retirement. I'm at that point now. I'm thinking about retirement, but I know when I do, I've limited myself on what I'm going to bring home, and that's what I'm going to bring home for the rest of my life. And who knows if that retirement fund's going to adjust to the cost of inflation. But there will be a time I have to. And now you think, I can't spend. And if I need this, and I'm buying all these medications, people are going to the pharmacy spending $700 and $800 on medications. That's $700 or $800 that can't go to food, can't go to heating and cooling their home, taking the medicines as prescribed because they'll cut them in half and try to extend them out. They get confused on how many they took. I skipped yesterday to save this one for tomorrow. And I hate to say this because every time we start bouncing in abuse world, there are people who will come get their medications. Well, grandson needed a pain pill. He was hurting really bad. I can't stand to see someone hurt, so I gave him one of my pain pills, and now I'm hurting. Is that abuse? It's non-compliance. I don't know about abuse, but it could be. It could be. A lot of these we've already mentioned, so here we are in that old abuse neglect time frame. How many of you have made a call already on your ambulance ride-outs where you walked into the home of an elderly patient and went, damn, you have to live here? Luke, you've had one already where you went, damn, you have to live like this? Any others? You will. Luke, what was so damn about it?
So one of the early labs we did where y'all were saying patients usually fall between the toilet and the bathtub. Well, that was exactly what happened. But his house was just, he had
Can I pause you there for a minute?
Yeah.
Can anybody create a reason as why that's a common place to fall?
Getting out of the showers.
Okay, it's slippery, getting out of the shower.
They're wet.
Training and
Yes, straining and vagling down. So were their pants down? Were they using the bathroom or getting out of the shower?
I think he was emptying his catheter.
Now,
he was-
I don't know if you know this or not, but when you put a catheter in your bladder, or somebody puts it in your bladder, or you put it in someone's bladder, and the urine's going to start running out, you have to, if you're doing the catheterization, you have to let that urine out at a slower rate than what it wants to come out. If you void the bladder too quickly, it'll vagal out. So all mammals take about 20 to 30 seconds to urinate, no matter the mammal. So if you let that out in 5 seconds, it'll vagal them down to nothing. So the catheter could have been the problem. Was he one of those guys who had to put the catheter in himself?
Well, he was a hypoglycemic. He was.
You had a lot going on.
Yeah, he was a double amputee, diabetic.
Why did he fall? He didn't have any. No. Easy, Brandon. Easy.
And of course, the paramedic gets the legs or lack thereof. And
Like the nubs,
yeah, and I'm carrying his upper part, so
carrying him where, to the cot?
yeah. And basically he was living with 3 other people.
So he had. So let me say this. He had a urinary catheter in his bladder.
Yep.
He was a double amputee, above the knee.
Yes. Yeah.
He was also a diabetic. That's probably why he's a double amputee.
Yep.
Was he obese?
Yes.
How old was he?
He was in his 60s, I think.
I'm guessing he probably has dialysis, kidney issues as well. Don't know.
I don't know that. I know his blood sugar was 51 when we did it the first time.
That's probably why he fell. So was he transferring from the toilet to the? I mean, what?
So
Was he trying to get out of his wheelchair over to the toilet?
He defecated on the floor, and his wheelchair was towards the entrance. I think his. I'm assuming they're his kids. Were trying to get him up, and they moved it to the doorway, but I mean there was like poo everywhere, so they gave up and called us so we could do it. And I mean their whole house was just trashed. So, yeah.
Were you appalled at the living conditions?
I was. The second I walked through the threshold, I mean, it just punched.
New world.
It punched you in the face.
So he was living with 3 other people.
Yeah.
3 other people who required care? Or do you know that?
Who knows? No.
So what I was digging at there, what I was trying to get at, and I don't know the rule exactly, so don't quote me on this, but up to so many people, I think it used to be 7, I don't know if they've changed that or not, you can house these people in your residence and get their income from Social Security and Medicare and all that stuff without being licensed as a long-term care facility. And so there are people out there who will get elderly patients living in their homes, supposedly taking care of them. So when you go into a nursing home, you get checked in for a long-term nursing home care, your finances go to that facility. You sign all those retirement and Social Security checks over to that facility.
Well, I think.
And if that doesn't cover the cost of it, they put a lien on your property. The largest real estate holders in the state are care facilities.
Well, they knew what was going on with him because they told us he has blood sugar issues.
So it's more of a family environment.
He had half his sandwich in his mouth when we found him. That we had to get out, and then the other half was sitting on the sink. So.
Are you picking this up? Do I need to stand closer?
Do
Okay.
I need the mic?
No.
I'll tell the story start to finish. So, yeah, that was Friday. Bonham. No, that was Denison. Saturday.
So not to jump too far out, but hey, we're here. Let's talk. Would you felt like that needed attention from a authoritative body like Child or Adult Protective Services? Do you think somebody from the societal safety net, if you will, should come in there and go, let's look at this?
Yeah, just considering he's a double amputee, that alone really limits his options. He had stairs going up into his home. He didn't have a ramp, so I don't know how he
He probably didn't get out.
traversed that.
If they did, they helped him.
Yeah, so, and he was extremely hesitant. The family told us to go to the hospital, and when he woke up,
It never turns out good, I bet, when he does go.
he was passive aggressive when we woke him up. So,
What? Yeah, did he have dementia? Well, he obviously had blood sugar issues, which will make the brain mad. So, okay, yeah. Welcome. you should get a sticker that says I voted or something, like welcome. So you're initiated into the club now, okay? Yeah, you wiped an adult. So very good. Very good. It's all coming for all of you. So if you continue to do this, you'll see it. It is everywhere and it's rampant. So any questions about the things I was throwing at him, like caring for people in the home? Let me ask you a statistic now that you've seen this and we're talking about it. How many geriatrics, what percentage of the geriatric population lives at home? What percentage of the geriatric population lives at home?
I would say like 80 or 90.
I'd
What's
say
at
like
home?
20.
In other words, not in a long-term care facility, not in a nursing home.
I'd say like 20.
I'm gonna say 50.
80.
That's fair.
Y'all range from the low of 20 to as high as 80.
Yeah.
20? You think about 20% of the geriatric population lives at home. And the other 80% is living in a long-term care facility.
70%.
Japan, maybe.
Exactly.
Do what, Riley?
Well, they might not be able to afford a long-term care facility or have people to get them in.
And don't you think that they have talked and at their little church camp and said, hey, if you go into that nursing home, you've lost your money, and I hope you signed the property over to your family at least 5 years before you go into that facility, because there's a statute of limitations, and it all gets really weird. And I'm no attorney on that, so don't take my word for it. But they can get your property.
What is this statistic?
I think a lot of families don't.
Better than 90%, like 95%, live at home or do not live in a long-term care. Well, we're biased to that because where do we always go? We run to those nursing homes, and we see nursing homes cropping up everywhere. And but most of them live at home. The challenges that they have, though, at home are much more than in a nursing home. At least there are buttons, there are beds, there are people that walk by. We won't argue about the quality of that. That's not what I intend to say. But we know at home, I know transferring an elderly patient from home to a nursing home, and I've done that on the ambulance because they're non-ambulatory, means they can't walk, and you have to have them moving with a stretcher. And you think about that and go, man, they just wanted to die at home. Man, he built this house. Man, his family's lived here for generations, and it looks like this house and this property is going to be divided up and gone and sold. And it's kind of sad, but from a physical being, it's oftentimes better care in the facility than it is at home. I mean, look at what you're talking about. This guy's laying in a floor poop. in his bathroom with no legs. He obviously, his food's not controlled, his blood sugar's not controlled. He had to call on the resources to come get him, and that resource is you most of the time. Very good. Very good. Jordan's already alluded to this. The trauma is significant here because of blood thinning medications. Is there anything else that will add to the complexity of a trauma call outside of blood thinners? Well, they don't have any reserve capacity. The beta blockers and all that stuff keep them from compensating in shock. She's right about the bleeding risk. And they're more likely to suffer trauma. Was yours a trauma call?
It was a fall involved, so kind of. No,
But it was also a hypoglycemic
it
call.
was medical, then. We threw-
So there, you've answered my question. What makes these trauma calls more serious? They're often preceded by or accompanying with a medical call as well. Why did you fall? You need to ask yourself that. You're going to be responding to a fall, and then with especially these geriatrics, why did you fall? I got lightheaded. I picked a lady up who, and my call was she had a broken wrist. And I go to her back door apartment in Bonham, and it's like 11 at night, and she's sitting there, and she has that fractured wrist, and it's like this. That's called a Colles fracture, C-O-L-L-E-S, like petting the collie dog. I know the spelling's different, but bear with me. This is a reverse Colles. This is a Colles. She had a Colles fracture. I go to bandage it up. Now, Bonham Hospital is not an ortho hospital, and I should have taken her to Sherman or Denison. I get in the ambulance, and I have an EMT partner who's in paramedic school. He's like, hey, I can count this call if we do an EKG on her. Can I do an EKG on her? I'm like, sure, do an EKG on her. I said, I'd rather you bandage that wrist because I don't know how, but you go ahead and do the EKG and I'll try. So we got her wrist all put together like this. He's got the EKG on, he prints it off, and he's like, what do you think about it? And I'm like, I'm glad you did that. I have a cardiac patient. And I said, ma'am, do you have a pacemaker? Is that what you're talking about? Oh, she's got a pacemaker. She didn't only have a pacemaker, she had an implanted defibrillator. Ma'am, why did you fall? I don't remember. It just, everything went black. Okay, maybe I do need to go to Bonham. So I took her to Bonham because I didn't have a 12 lead and I knew they did because we didn't run 12 leads at the time. Took her to Bonham, did 12 lead. They call her cardiologist, get all this information because she's a resident of Bonham and her family doctor's there and stuff. She's had, long story short, she went into VFib, it defibrillated her. She was coming home from a night of bingo, went to go to the back door when she had a moment of VFib. They found this because those monitors, those defibrillators record the last so many hours and they just go on a loop, you know. So it had shocked her, resulting in, when she fell, passed out because of it, resulting in the fracture. And I'll never forget that one because I got chewed out by my people for taking her to Bonham with an ortho. I even got chewed out by the nurses when we walked in there. You know you can't bring a bone fracture here. Shut up for a second and listen to me, please. I've got indications here that this lady has got a cardiac event, which, in all honesty, I should have took the cardiac event out too. So we transferred her later, and then my guys that were up for the transfer got mad at me. You just shook that call off. I'm like, I just didn't want her to go into VFib on the way to Sherman, okay? I don't have a protocol that will support this. So keep that in mind. What caused you to fall? Can the fall cause a medical event? It could cause a hemorrhagic stroke, couldn't it? And we already talked about that. So it's tough. It's tough, and we have a whole lot of them. 65 years or older is basically considered geriatric. Regan and I were joking this morning. We're past 50 and we get the AARP flyers in the mail. And now I don't get asked for my ID for alcohol. I get asked, do you qualify for the discount? No, I'm kind of stuck in the middle, okay? I'm old enough to do this, but I can't get the discount yet. I don't think I'll take it when I get it, but 65 is what the rule says.
You get a free fishing lot?
Do you?
5.
In Oklahoma?
Maybe, look at the,
I'll have to look. I may get a free day pass or something. I know you get a break on your campground fees. That's in half. But yeah, and we should. We should. When I was on the ambulance in 1989, 90, in that time frame there, a person who was over 100 years old at that time, and I transported them, I remember them. What year were they born in? 1889? I'm talking to people whose parents talked about the Civil War. So let's pick up someone today that's 100 years old. What are we in, 2024? They were born in what? 1924. What have they seen since 1924? What have they lived through?
World War II, couple of Vietnam.
Couple of world wars. No, one world war. Yeah, you're right. Vietnam, Korea, Depression, the Great Depression, Dust Bowl. A lot. A lot.
Price is right.
Reagan, Price is Right. Yeah. Thanks, Frank. Thanks. Their sunlight years were Price is Right. They've been through a lot. Do you think they have good stories? Do you think they want to tell them? Oh yeah, yeah. What was it like? It was great. It was awesome.
What was it like in World War II?
It was awesome. I was real close to Vietnam, but I just remember people. I do remember as a child, and I guess it's because my uncle was over there. I remember him coming home. So, but I didn't see the Great Depression. Saw the Great Recession, but not the Great Depression. Oh, me. Talk to them. They're a fascinating group of people. They love to tell their story.
What were you doing on 9/11?
What was I doing on 9/11? I was changing a diaper on my little boy, my son. I was getting him ready to go to work with us. I was self-employed at the time, so I picked him up and I was changing the diaper in the living room, and that was on TV. And my mom called and said, "You watching TV?" And I'm like, "Yeah." I said, "That's odd." I saw the first plane. The time I got his lunch packed, and we were going to go out and work. He went with me while I worked, and time I got everything ready to go out the door, the second one hit, and kind of figured out something weird was going on. I went and got the guys that were working for me and got them. I said, "Y'all need to go home." And then went by the school and got my daughter out of kindergarten, and they didn't release the school until a little bit later, and then my wife came home. So, yeah, I remember it. I remember when the Challenger blew up. That was the first one, wasn't it? Yeah, the Challenger explosion. I was in high school wood shop. And what was weird is they said, "Oh, the Challenger blew up. Y'all get back to work." You know, now we take school out for a week. I'm sorry, I didn't mean that. Hope I didn't trigger anybody. So treat them with respect. They've seen a lot. They've been through hell. Some of them have literally been through hell in the world wars or Vietnam or whatever else they might have done more recently in the more recent wars. Those people haven't gotten that old yet, but they're coming. So they quite literally could have been through hell. Everybody talks about food lines and starvation and how bad society is. And if you talk to one of these older people, they're like, "You got it so damn good. We don't have it bad. We don't have it bad." I had an old gentleman, I dropped at the price of gas while he's standing there with me. He owned the filling station. And I said, "I can't believe gas is $2 a gallon. Now I wish it was $2 a gallon." He's like, "Yeah, and I can't believe you bring home $750 a week," or whatever it was. He didn't know. And I said, "What are you talking about?" He said, "Well, when it was 10 cents a gallon, when I grew up, we brought home about $5 a week." I'll shut up. I'll shut up. And then I popped off and said, Well, I bet back then you stayed in shape good because you guys worked so hard. And he said, we stayed in shape because we starved. We didn't have anything to eat. I'll shut up. Keep talking, Brandon. Just keep talking. Not all of them have dementia. Not all are hard of hearing. And not all are sedentary, or other name for that is immobile. That's going to be me. I'm never going to lose my mind. I'm always going to be able to hear. And I'm always going to be mobile, right? Yeah, I hope so. You remember me talking about the terminal decade? How do you want to be physically and mentally in the last 10 years of your life? Because you don't know when that's going to be. Well, the work starts now. And I wish I'd have paid more attention when I was your age to get there. Because I don't want to be that guy that has no legs, Luke, that you had to come clean me up and get me out of that environment. I know that's not a good environment. I know that's not good. I might act a little hard of hearing and crazy too. Right? This is what I've worked for. This is what I get for all the years I've put into investing in my family and my work. I get this. You can understand depression now, can't you? Would you believe me if I said the majority of alcoholics are in this age group? Yeah. This is where alcoholism becomes a big deal, is in the geriatric age group. They got a little money. They don't have to be responsible to any employer. They don't have to wake up the next morning for any other reason. And they start drinking. And they do suffer from the liver failure because of it. A lot of these people drink. So be aware of that. They may be proud of it too. That's kind of a little bit of the difference between the younger person. They may be proud of it. Don't call them sweeties, gramps, mama. I'm a firm believer of, I will call them Mr. or Mrs. until they tell me to call them George or Susan or something like that. But come on, sweetie pie. Let me help you up here. Don't do that. They don't want to be called that. Use their name. Use their name. I've had patients lie to me to get out of the condition they're in. And those are funny stories. When they lie to get out. They've lied to get out of nursing homes. They've lied to get out of their own homes. They've lied to me to get away from their spouses. It's kind of crazy. So take what they tell you with a grain of salt and see if it goes to their environment. Explain what you'll do before you do it. So if I pick up a lady's arm, she's not with it mentally. Maybe she's in a nursing home and she's just laying there staring at the ceiling. Should I tell her that I'm about to take her blood pressure?
Yes.
Ma'am, I'm about to grab your arm. I'm about to take your arm and put a blood pressure cuff on it. I'm going to take your blood pressure. Is it okay to even say what the reading is? You think they might have that question? Well, if you're taking it, what is it? Just because they can't speak or communicate doesn't mean they can't hear you. I am as guilty as anybody would be guilty about going into nursing homes and finding these A&O times 0 patients and never saying a word to them. Never telling them where I'm taking them, what I'm doing with them, why I'm doing what I'm doing. You're communicating with your partner, you pick them up on the draw sheet, hope you grabbed the catheter and didn't jerk it out of them, put them on there, cover them up, take them outside in the cold, take them to the hospital, call a report into the hospital. And let's just assume they're hearing all of that. Without explanation, that's got to be a really traumatic thought process. Really traumatic. So please talk to them even though they cannot necessarily respond to you. If I tell you that the most common cause of a fatality in a geriatric patient is a hip fracture, believe me. Most hip fractures in geriatrics are fatal. Not because of the bone break, but because of pneumonia. So once they were mobile, now they're immobilized because of the fracture. They will get pneumonia very easily. And you will often go back to the home or to the nursing home or to the care center to pick up the patient you grabbed last week with a hip fracture. Now you're taking them in with high temp, productive cough, sepsis, fever, chills, and the like. So most hip fractures are fatal. So much so that when you go into a home to pick up somebody out of the kitchen floor because the little lady slipped and broke her hip, odds are that's the last time she'll be in that house. And if that's the house she's lived in her entire life, she may never come back to it. And they know this, so are they going to lie to you during the assessment? My grandmother broke her hip, and I had to go check on her because they call me when things go wrong. And I said, Grandma, we need to get you to the hospital. I'm going to call an ambulance because you can't ride in the car. She's sitting in a recliner. She said, I'm sitting here. I can sit in the car. But I'm not going because my leg's not broke. And she picked her leg up and started doing this with it. And I'm like, you can't do that. You got to stop. But how is she doing it without pain?
She's pretty cool.
She's pretty cool. She was a tough old thing. And she went and got her hip fixed and came back home. She died in a nursing home, but not because of hip fracture, because the nursing home would take better care of her than others did. They don't have pain like we have pain because the neurons have changed, the nerves have degraded, and they're tough. And there are a lot of ands in that sentence, they're lying. Why do they want to lie about this? Autonomy. You're going to lose it all. You're going to lose it all. So, that sedentary lifestyle can be brought on by a fractured hip leading to pneumonia and the blood clots and the PEs and stuff like that. So they're very prone to this. You need to know this word here. It's called osteoporosis. We tend to think elderly women get osteoporosis, and that would be a correct statement, but elderly men do as well. It's a drop in estrogen levels in both sexes. Men, you have estrogen for repair. You would never want to be 100% free of estrogen. Because Luke, when you go to bodybuild and you're building the muscle back and you're repairing the muscle that you tear down, you heal the joints, estrogen's doing that. Estrogen's doing that. So we need some estrogen, both male and female. But estrogen is so predominant in females, ratio-wise, that you see the osteoporosis show up for that. So they take hormone supplementation, they'll wear hormonal patches and the like, and what do we already know is the risk of wearing those? Blood clots. Blood clots. PE. Osteoporotic bone, loss of calcium in the bone. When I took EMT here, our EMT instructor had a healthy femur and an osteoporotic femur of about equal size. And she made us pick up the healthy femur bone and then pick up the osteoporotic bone. And relatively speaking, the osteoporotic bone felt like it was made of styrofoam. That's how lightweight it was. That's how porous it is. Osteoporosis, osteoporotic bone, porous meaning pores. So it loses its structure. It just becomes more and more porous. They become so brittle that just the act of standing out of bed could shatter a hip. Just standing up out of bed and it will just shatter, just the weight transfer. And that tends to show up in the hip because that's the bearer of most of the weight, but it can happen in the spinal column, the clavicle, the humerus, any bone. They all become this way. They all become super weak and brittle, and they just crumble. They just fall apart. Back in our day when we'd put patients on backboards, that was an issue. So I need a model. Nobody wants to model for me? Come on, Carson. Come model for me.
What do I need to do?
You need to go change into a Speedo and come back. Okay? No, do not. Do not. Okay. So three words I'm going to tell you that relate to spinal breaking apart and osteoporosis. The first one is kyphosis. So imitate a hunchback for me. Now put your head up the best you can. Keep bending over. Keep bending over. Kyphosis. Abnormal curvature of the upper spine. Kyphosis. I'm not done with you. I said there were 3. Kyphosis. We're going to start top to bottom. It's kyphosis. Abnormal curvature of the upper spine. I don't know if the lady has to be dead now. There was a little old sweet lady worked at Walmart in the fabrics at Walmart. And she was so kyphotic that she was probably 5'5" at one time, and now she's 3'5". It almost looked like her upper spine became an N, the shape of the letter N, and then her head was back out like this. That's severe kyphosis. Can you imagine laying that on a backboard? It's not going to happen. Abnormal inward curvature of the lumbar spine called lordosis. You gotta put your butt out. Put your butt out. Butt goes out, shoulders go out, this goes this way. What's happening is, it's hard to do, isn't it? What's happening is the weight is, you already have a curve in the lumbar spine and now it's just exaggerated. Not to be sexist here or get too out of the norm, but lordosis butts are liked by people who want to be models because it makes the butt pop. And it's actually a bad spinal condition because you get spinal issue. Lordosis, lordosis, not lard ass. Lordosis. And then an abnormal lateral curvature of the spine called scoliosis. By definition, scoliosis is any bend more than 15 degrees. Everybody's got a little bit of bend in their back. But if it gets past 15 degrees, it's called scoliosis. And once it starts breaking down, this just becomes more of an S shape. You can remember scoliosis with the S. You're good, Carson.
Any bend more than 15 degrees?
By definition, it's scoliosis. And that's a lateral curvature of the spine, anywhere, from top to bottom. S-C-O-L-O, L-I-O-S-I-S. S-C-O-L-I-O-S-I-S, scoliosis. All of these occur in the breakdown of the body, breakdown of the muscle tone, and then breakdown of the bone itself. So scoliosis, lordosis, and kyphosis. So when you hear the word kyphotic spine, you know somebody that's hunchbacked up. You also know that everything's so weak and so broken down that once they fall, it's pretty major issues, isn't it? It's pretty major issues. So what else is protected in that spinal column? What's in there that's being protected? The spinal cord. And so you get these neuron deficits and stuff like that. The neuro deficits, the paralyzation and things that go with it. Here are the 4 horsemen. We can group that into the 4 like we talked about early in the course. As I give you guys off to other people and I give you off to live the rest of your life and work in this career, if you take anything from me, if there's one thing that Brandon said that I would want you to know for the rest of your life, it's the 4 horsemen thing. Please stay healthy. Please stay healthy. Us old guys will certainly encourage you to do that. Okay? Got to have that resilience. They're going to have this. And they may have all of this. Can you imagine having all of this? I can't imagine having one of them. I don't want one of them. Think about taking enough medications to fix all of these every day. What are you doing in those years? Going to the doctor, the ER, and the pharmacy. You might make an occasional Wednesday morning trip to Walmart. I can tell what day of the month it is by who's in Walmart. Fixed income people. I can tell which long-term care facility or assisted living facility is running the shuttle bus? Sad. It's sad. That in itself is sad, then to have all these on top of it. Just an FYI, I guess. I guess it's just an FYI. I mean, is it complicated to assess? Is it complicated to treat? What are you going to attack first? That becomes more prevalent in paramedic, where you have drugs that you're going to give these guys or girls, and how are they going to correspond with that? This is just where you become sick. You're just sick. You're chronically ill. You're not going to recover from this stuff. Left untreated, they die from it. So the list is almost identical. Almost identical. Questions on that so far? I'm going to skip through the changes of the body relatively quick. If I see something that needs to be talked about, I will. But I think we know that we degrade. Have you ever seen people who don't want to eat when they're old? And poor nourishment? Do you know why? Do you know why they're oftentimes poorly nourished? Well, one, they can't afford good food. Number two, it doesn't taste good. It doesn't taste good. They lose their ability to taste. Last Thanksgiving I made dressing. I do all the Thanksgiving cooking. And I made dressing. And my mom's like, I love dressing. So she was eating and she said, did you put any sage in this? It was green. I had so much sage in it, it was green. I said, yeah, Mom, I put sage in it. She's like, where's the damn sage? You didn't put any in here. You have lost. I mean, if anything's going to fire off a taste bud, it would be sage. If you notice, the PowerPoint starts repeating pulmonary. I mean, you know this already. If you don't know this by now, where have you been? Where have you been? You know about cardiovascular disease? So we can roll right through this. Isn't that amazing that you guys can read this now and know what all that means? You could not do that in August. You could not do that in July as a whole. Some of you probably could. But now you know what hypertrophy means, don't you? And you're thinking to yourself, I hope he doesn't call me out on that. Gus, what's hypertrophy mean?
Is that the one where the heart goes bigger?
Yeah. It's a cellular adaptation where the cells get bigger in response to stress. Very good. Do you know, here's a good one, stare it. Do you know the formula, the equation for cardiac output? The slide says cardiac output declines. So that formula said, anybody want to help him?
Stroke volume times heart rate.
Yes. So which one of these is falling off in the geriatric? Stroke volume. Most likely stroke volume. Could be heart rate due to beta blockers. Could be heart rate due to beta blockers due to overdose of beta blockers, non-compliance with medications. But you see how the stuff just starts repeating itself. And I think if there's any takeaway from geriatrics, it's all here together. Where we did it individually, kind of like the geriatric has all of it, puts it in there with it. And we already know about all that. So, like I said, I don't want to delete these slides because it's posted, but please understand we've talked about this, so I do not want to waste your time doing it. I will point out one more time the silent heart attacks, because that's important here. They don't present with your typical chest pain. They're not the greasy 40-year-old white guy who's sitting there going, oh, I'm dying of heart disease. I think I'm having the big heart attack. They've been nauseated for 3 days and don't know why. They're weak and nauseated. That may be the only symptom of a heart attack. With that being said, I just ate something bad. Maybe I'm talking to myself. I just ate something bad and I'm just getting weaker. I thought I better go get me some IV or something. And then they have the heart attack. So please consider that. Run the 12 lead and transmit it. No one's going to get mad at you for running a 12 lead and transmitting it in these elderly patients. I told you a story of a woman that I was so concentrated on her wrist. It took an EMT who's in school. I'll get that for you. You sheltered good kid.
It bounced on the edge 3 times.
You sheltered good kid. You're picking up bad habits in here, stare it now. Picking up bad habits. I don't want to read this. I had every one of those last night. It was the burger. It was so bad that I thought I would call somebody, and a friend of mine, and put him on speakerphone. So until I got through this, I couldn't call my wife because where she was at. That's how bad it was. Huh? Hey, I lived through it. That burger was bad, wasn't it? You know about left and right-sided heart failure? We talked about the swollen ankles, the edema, the pulmonary edema, the ascites in the abdomen. So we shouldn't have to go through that. If this is looking foreign to you, you should go back and rehearse that cardiovascular chapter. I think the registry will want you kind of differentiate between right-sided and left-sided heart failure. Remember, left side backs up in the lungs, right side backs up in the body. So left for lungs. If you're standing at Walmart and you look at this elderly lady's legs and you see varicose veins in the back of her legs, if you see her ankles spilling over her sneakers, if you see her wrist, the skin, the edema on her wrist starting to cover her hand, if you see a belly on her, she may be and probably is obese, but her liver is also probably huge. Big, heavy, what we call fatty liver disease. And it's also backed up full of blood. They are taking blood thinning medications. They're at risk for rupturing what we call esophageal varices. And when that ruptures, they got blood just pouring out of their mouth. It becomes an airway issue. A lot going on with these patients. If you get somebody with shortness of breath and they're able to do it, setting them up is probably the best thing to do. So I can see that as a registry question. You got that 72-year-old lady lying in a long-term care facility. She has rattles upon entering the room. Her lungs sound rattles, crackles. She is supine in bed. Your first action would be oxygen, transport, EKG, set patient upright. Set patient upright. Let gravity help you. Let gravity help you. You would think, well, she might need the oxygen because she's having trouble breathing. Well, we don't give the oxygen until we see signs of cyanosis or a low pulse oximetry reading. Paroxysmal nocturnal dyspnea, abbreviated PND. Do y'all know this one? Y'all remember me talking about it? You remember me talking about it when I said you walk in the patient's bedroom and their bed is elevated on blocks, like the head of the bed is sitting on blocks. They don't sleep in the bed anymore, they sleep in the recliner so they can set up a little bit. Paroxysmal means comes and goes. Episodical. The word paroxysmal means episodes. Nocturnal means at night. Dyspnea, shortness of breath. So they have episodes of shortness of breath when they go to bed. And that's a big indicator of left-sided heart failure. Okay? Just pick the, you walk in the room and go, you either have GERD or left-sided heart failure. What is GERD? G-E-R-D. It's an abbreviation for something.
Like stomach acid building up in the chest.
Yeah, it's gastric esophageal reflux disease, and elderly patients are prone to it. I guess I'm elderly because I frequent that. Gastric esophageal reflux disease. A lot of the medications they take will relax that cardiac sphincter. Now, your esophagus goes to the stomach and it just doesn't sit on there. It's got a valve, a sphincter. It's called the cardiac sphincter because it's real close to the heart. That valve loses its tone or tonicity and it doesn't stay closed. And when they lie back, especially, those stomach acids will regurgitate back up into the esophagus and start eroding it because it's a real bad acid, right? Got a pH like 2. And so it starts eating on the esophagus. And it can actually burn through the esophagus and then start eating on the aorta. So some of these people die of an aortic issue due to the acid issue. Sucks to get old. Sucks to get old. We already know about stroke. It's the leading cause of death. It's the leading cause of disability. But it is not the leading cause of payout. Let me explain what I mean by payout. When you group disabilities by conditions that some entity will give you a check for, like there's Social Security disability benefits. If you qualify for a disability with Social Security, you'll get a benefit check. And you can get it earlier than your retirement age. So Luke, you're working in a factory, you're 50 years old, you're not eligible to draw Social Security, but you become disabled, you can ask the Social Security Administration to pay you. And they'll say, well, if you never work again, we'll give you a little bit of money. It's called Social Security disability benefits. And some of your health insurance may have those clauses in there. Of the top 10 payouts for disability, 9 of them are paid out for mental health. The other in the top 10 is stroke. So 9 of the top 10 are mental health disabilities. Okay, sure. The other one is stroke. You know what it looks like, so we don't have to go through all that. What makes this population worse about a stroke, though? One more time. I need to hear it one more time. Geriatric, and more specifically, what makes the geriatric such a problem with strokes? Huh? Blood clotting. Yeah, blood clotting and blood thinners. Blood clotting and blood thinners. Cataracts. Let me tell you what that is. And you possibly could see those when you're doing an assessment by shining a light in an elderly patient's eye. You can see one of two things. You could see like this cloudy blob. It looks like a dirty windshield. Like something's in your eye. If you can see a cataract, then imagine how limited their vision will be. You can also see a funny reflection if they've had cataract surgery, to where the eye doctor goes in and cuts out the cloudy lens. That's what a cataract is. The lens of your eye gets protein deposits over it, and that protein builds up and builds up. Who wears contacts? Do you ever get the contact? It's like it's time for that one to go because I can't get it clean anymore, and I put it on and it's disturbing my vision and it's cloudy. Try to get maximum mileage out of them. Yeah. Some of them are daily. Even the daily ones I would wear 2 weeks.
And then you have the ones that you can change out every month.
Yeah. But you know when they get protein built up on them because you don't see as well. Huh? It falls out, doesn't stick? Yeah. Well, the lens inside your eye gets protein deposits on it as you age, and that's called a cataract. And it usually occurs in both eyes. And when they go and do the surgery, they'll do one eye at a time. So if they mess up, at least you'll still have one eye. It's pretty much outpatient. It's very routine. It's kind of nice because they can correct your vision at the same time. They can put a lens in that can correct your vision. So it's like a permanent contact, only it's inside your eye. But when they do that and you shine a light in it, you'll see it's kind of like bouncing off a mirror at certain angles. You're like, you've had cataract surgery, haven't you? I'm like, yeah. You been to the eye doctor lately, Regan? I know I have. And they're like, you have a slight cataract. It's probably not going to cause you any problem for a long time. And I'm like, that's the first time I've ever heard that word applied to me. I'm like, no, I don't want to get old. What is, so that's cataracts. What is glaucoma? What is glaucoma? Glaucoma. Glaucoma. It's another eye issue to where the pressure inside the eyeball, the intraocular pressure, is higher than normal. It, in essence, creates a bed sore on your retina because the pressure is so high, the capillaries in your retina do not get the blood supply they need because there's pressure keeping the blood out, leading cause of blindness. So you people who visit your eye doctor and they puff the air in your eye, they're checking for the pressure in your eye, the intraocular pressure. And if it gets too high, you're diagnosed with glaucoma. There are some medications that they give that can also raise that pressure, and you can't take them if you have it. Leading cause of blindness. Retinal detachment is also common in these individuals, where the retina just detaches from the optic nerve. A lot of stuff goes on as they get old. Macular degeneration is the other one. Oh, I don't know how many of you are getting close to 40. That's a guarantee. That's a guarantee. That's the people wearing readers. They can see far away, they see fine, but all of a sudden, like somebody flipped a switch and I can't see up close, and you got to wear readers.
I'm already on the struggle bus.
You're already on that struggle bus? Then you'll get bifocals.
Yep, I already got them.
You already got
No
bifocals.
transition.
Presbyopia. And it's so automatic at 40 years old, like on your 40th birthday, you should ask for readers. It's going to happen. Here we go. I'm 55 and I don't need readers. Whew, it pisses my wife off. And I argue with my eye doctor. But if I correct both eyes, I need readers.
Wear a boot every now and then.
I need to. So I only wear one contact, so I can still see up close. If I put a contact in both eyes, I could really see far off. So I'm compromising, you know.
Is there some like way that you can avoid that ever?
Yes, there is a way to push it off. It is occurring in younger and younger and younger now because of screen time. Screen time. Because, Frank, let me rephrase that. I don't want to mislead you. Looking at screens all the time damages your far off vision because you stop the ability to focus far off. But the screen time does affect the visual processing in the brain. And when you look at something that's not a screen, you don't see it as well. Like printed word on a screen, vibrant, rich, detailed, sharp, crisp, high resolution. And then you try to read the Bible in church, and you're like, I need a flashlight. If you ever go to church and see old people with flashlights in the back reading the Bibles, because get your Bible on the phone so you can highlight it and brighten it. My wife will not increase the text size on her phone, and I'm like, why don't you just, she's, I am not going to be one of those old people. I'm like, you're wearing the readers. You're an old person. You'll get by better with the big text size than you will the readers. Quit lying to yourself. Hearing loss, big deal with them. Speak to them clearly, like you normally would, but just look at them so they can read your lips. Don't yell. Don't get in their ear. Look at them. Speak normally. Use the written word if that works better. If the hearing aids aren't in the ear, you may have to go get them, and I don't like doing that because they're kind of nasty. Had an EMT student one time that wore hearing aids in both ears. He was about your age, Gus, and he already had hearing aids. You could tell he had a hearing deficit from an early age because his speech was messed up. Good kid. He's actually a paramedic now. Went in the ER, went to take a lady's blood pressure doing his clinical rotations, and he took his hearing aids out and handed them to the patient and said, can you hold these while I take your blood pressure? And she went, I guess. I wasn't there, but my preceptor said he pulled out the longest, orangest earwax with those. Can you hold these? Lesson, if you wear hearing aids, don't ask somebody else to hold them. If they're wearing hearing aids, your siren is debilitating. It is debilitating. That's a terrible, terrible thing to hear with a hearing aid. Of course, it amplifies it, but the tone of the siren is just way out. We already talked about the taste, touch. Get a lot of burns here. They don't know that the bath water is burning them, so you may see that. If you see all that kind of stuff, don't be afraid to call Adult Protective Services and say, I don't think they're living in a safe environment. They'll come out and do an assessment on that home, and it may be that they call the plumber to turn the water heater down. It may be that they call, in your case, there's money out there from the taxpayer funds, the security net. They'll build a ramp to that house. You go in a house and the toilet won't flush and they can't afford a plumber, call Adult Protective Services. Say, there's help for this. How come you haven't flushed your toilet? Well, it's backed up. It's been backed up for years. You know, they got the trash can full of toilet paper. Call the people. Call the people. And it's not punitive. They don't come out and take you away. They come out. They do not want to take you away. It's cheaper for them to fix your toilet, fix your ramp, put a roof on your house, get hot water in the house, get a tub. I have a friend who works in that field, and he said, it's amazing what they will pay for. It's amazing and it's no questions asked. It's easy. It's an easy process. APS does all the work. So don't think of APS as just abuse. Think of it as, hey, we can help you live in your home because we'd rather you stay here. It costs a lot more to send you to a nursing home. And the federal government knows that. And so please be aware of that. Alzheimer's, Parkinson's. Y'all know the difference between the two? Between Alzheimer's and Parkinson's?
Parkinson's where you shake.
Yeah, it's the repetitive movement. Yeah, it's a loss of mental faculty. Yeah, it's a neurological disorder. The synapses in the brain are breaking apart, and they're wired up differently. One of the early indicators of Parkinson's is someone pill rolling. They call it pill rolling. So if you see your uncle sitting there at Thanksgiving doing this, he's about to get Parkinson's. They just sit and they call it pill rolling, like if you had a BB in between your fingers, just sitting here doing that. Michael J. Fox is a famous Parkinsonian, and his was an eye twitch that wouldn't go away. And he went to the doctor with an eye twitch, and now you know how he is. So it's neurodegenerative issue. In the same family of MSMD, it's also in the same family as Alzheimer's. You can make the argument that Alzheimer's and mad cow disease is the same disease. Structurally, if all you looked at was the brain, without anything else, you would have a really hard time determining is this Parkinson's, Alzheimer's, or mad cow disease. It's one of the four horsemen. Neurodegenerative. The guy riding that horse of neurodegeneration. The most current research says it's type 3 diabetes. Because we live in such a high sugar environment anymore, that we already know that it destroys your capillaries in your eyes, causes blindness. We already know it destroys capillaries in your kidneys, causing kidney disease. It makes perfect sense that it would destroy the capillaries in your brain and cause these diseases. So it is a leading cause of death. What, you about to knock her out for scribbling?
No, she's just doodling a big, just scribble.
Just scribbling?
Just a scribble.
How do y'all feel about people? What's your personal feeling with Alzheimer's patients? I mean, what do you think about them?
Sadness.
It's sad.
It's scary sometimes.
Sad, scary. Don't want it. Horrible disease. It is horrible. It's horrible for Grandpa not to remember who his wife is. It's horrible this time of year. A lot of suicide in this because they do have little episodes as well. They'll get their faculties back and lose them, and sometimes they're aware that they have forgotten. Like, I can't remember anything anymore. So they know they're going downhill. Have y'all been in the dementia ward of nursing homes? Where they're behind the memory care. Oh, okay. We gotta be PC, don't we? Your grandpa's nuts. No, Jesus. Grandpa's lost it. I've been in there, and you find guys trying to take the toilet up from the floor, taking beds apart, taking TVs off of walls. They trip out. Mean. Sometimes I wonder if they're mean just as using Alzheimer's as an excuse to be mean. But they can be violent. They can be hard to control. Lonely, depression, aggressive toward other residents in the care facility.
That's why they keep them separate.
That's why they keep them separated. And when you go in there and the nurse says the keypad is 1, 2, 3, 4 pound. It's always 1, 2, 3, 4 pound. Or pound 1, 2, 3, 4. If that doesn't work, put the pound in front. You know what pound is? Hashtag. Okay, just get that straight. You're like, I can't find pound on here. Tic-tac-toe. And you walk in there, and now they start doing, as you walk in through there, they're like, hey, honey, come here. And they're just like on you and touching you. And it's like, come over here, sexy. And you're like, that's an excuse. And women get it too, okay, Luke? So women will be grabbing at you. Come here, you big boy. Oh, do they? That's your trip to Walmart, huh? Be careful, because these people they can be dangerous. This is why you don't wear the long hair, and because they can grab you and not turn loose, or necklaces, or ID badges around. You know what I'm talking about. I look at it like this. I'll just say it in one word, and then you can one phrase, you can take it for what it's worth. You'll never remember what you forgot. If you think about that too long, you kind of get a little nuts. You will never remember what you truly forgot. You may let a name slip from you, and then like a little bit later you go, Bill Henry, remember him? Like, you didn't forget that. It was back there, you recalled it. You did not truly forget it, did you, if you recalled it later? How about truly forget? You never know you knew it. It's kind of scary. I was a junior in high school, and I knew every 77 counties in Oklahoma. I do remember how many, and that was part of our test. We had to label them all, so we memorized and memorized and memorized. Why, I don't know. They don't have to do this in Texas. There are too many. There are too many here. But I remember doing that. Now I'll watch a weather, or I'll watch a news story, and they'll say Lattimore County or something, and I'm like, is that in Oklahoma? At one time, I knew it was. I even knew how to place it on a map, but I can't do that now. I think there is also, my hard drive's full, and we're going to kick out useless information. And Einstein said, why memorize what you can reference? And there's probably, all you need to know is where the library's at, or Google. So I think I've just, through lack of use. But I use that as an example, is I have truly forgotten that. Imagine if that's your wife, your house, your address. When you see these silver alerts and missing people, these are your Alzheimer's patients that find the keys to the car that was supposed to be hidden from them, and they got in it because they were going to the store, and you find them in South Texas. These are the ones that we'll make calls on that are driving up the wrong way on an on-ramp to a highway. To see that happen, you're like, shut it down. There's argument for police officers and stuff to have the ability to shut your car off through Wi-Fi signals or radio signals. People don't necessarily want that, but they can do it through OnStar. If they can locate you, they can also shut that car down. And that creates a whole new societal issue, and we're not going there. Delirium, out of your head. Out of your head. What would be the first thing, here's the registry test question, the first thing in a delirium case you would want to do? This is a test question. You have a delirious patient, out of their head, confused, combative. What should be the first thing you do?
Check their temperature, blood sugar.
Blood sugar. Yeah. Yeah, we're worried about hypoglycemia. Right, Luke? 51. So what'd you do with the 51? Give him the rest of his sandwich?
No, he was about to aspirate on it. They gave him
Okay.
D10.
D10? I gave him sugar in the IV.
He woke up.
Then what'd he do?
You gave him a sandwich.
He got passive aggressive, so we just gave him pillow and blankets will be at TMC in 10 minutes.
Did you repeat the D10?
They had it on a slow drip.
Okay.
So at first it was quicker, and then he slowed
Okay,
it down.
cool. Absolutely. Just constantly feed it. Remember, if D50, which is 5 times more concentrated, 25 grams is that, you're only looking at 100 calories. Because there's 4 calories per gram of carbohydrate. So D10, that's 10% dextrose versus 50% dextrose. There's an equal decrease in the amount of calories you're giving him. So you're not giving him much. What's he really need?
That sandwich.
He needs that sandwich. He needs a little late. Did you check him for an insulin pump? Test question, National Registry style. Did you check for an insulin pump? Nope.
Say we did.
Nope, we didn't do an assessment. We were too worried about the poop all over us.
Did the sandwich drop in the food?
No, it was on the sink. So
I was real clean.
So if he's wearing an
It wasn't
insulin pump, you should DC it or turn it off or make sure it's not running. Because it's a mechanical device, it can fail. It could sit there and be pumping insulin in when it doesn't need to. Okay? Great, Frank. Check the sugar because he's crazy. He's mean. He's out of his head. Great, Luke. Give him the sugar. Transport him. He really needs the sandwich, but he can't do it because he'll aspirate on it. So we got to wake him up enough to get that meal in.
Am I wrong to check temperature?
No, you're not wrong to check it, but can you fix the temperature issue as an EMT? No. Can you fix the sugar as an EMT or paramedic? Yeah. So another clue on the registry, guys. Pick a choice. General rule. Pick a choice that you can do something about. It's your job to. If I've got it and can fix it, I'll do it. If not, then we take them to get it fixed. I'm just trying to program your brain a little bit on how that stuff's going to work. Frank, perfect. Hypovolemia, hypoglycemia, hypothermia, hypoxia. Can I fix that one?
Yeah.
Can I fix that one?
I forgot what it was.
Low blood volume or low fluid volume. Paramedic can. So in that one, I'd request ALS. Can I fix this? As long as they can control their airway. If not, ALS. Can I fix hypothermia? I can at least start going that direction, can I? With passive or active rewarming. Syncope, we know what that is. Loss of blood volume to the brain causes you to pass out. It's called fainting in general terms. Why are old people susceptible to this? Multiple reasons. Elasticity of the vessels is not good. Beta blockers not good. Low blood volume not good. Low cardiac output, just the list goes on and on and on. Most of the time, this syncope is caused by non-compliance with blood pressure medication. They forgot they took one and they took another one. Now they're toxic. Now you've got a beta blocker overdose or something. Or a recent change in blood pressure medication. Your lisinopril's not working. We're going to add a beta blocker to it. You come home from the pharmacy, take your first one in the morning, and they're out on the floor and you don't know why. Please research the cause of the syncope. Neuropathy, this is a term that I did not know in EMT school. I did not know this term in paramedic school. I did not use this term in the years I spent as a paramedic. This is a new term. New to society. It's always been there. But we just didn't have to talk about it. Can you tell me now why we talk about it? You see the definition. Why is it on everybody in healthcare knows this word now? Diabetes. The diabetic patient destroys their neurons and now they can't feel pain or they have constant pain. The sensations get messed up. This is why you'll find somebody who stumped their toe last week and now it's got gangrene in it and they don't know why. They're like, well, I didn't even know I hurt myself. You'll get up old people and you'll do an assessment and you're like, do you realize your toes are black? Why? Can you feel this? I can't feel anything. Do you know there are maggots eating in your foot? Huh? I can't see that far. What's wrong? They bump their toe, get in the mail, get some dew, get some parasites, get some fly larvae in their foot. They never know it. I've seen them so bad that I shouldn't admit this, but I tore a patient's skin going through the door one time. Stuff happens, right? Going through the door, and they never screamed, but I saw it happen. Oh, stop, his arm's in the way. And it tore his skin. He never screamed, never done anything. That's bad. GI changes, gastric motility, we lose peristalsis. Constipation is a big deal. This is probably a good time if they've got the complaint of, I haven't been to the bathroom in 3 days. Now, old people know when they go to the bathroom and they worry about it. They've heard that their buddy at church died of colon cancer, and the first thing he complained about was he didn't go to the bathroom for a week. The tumors in the colon get so big they block it. Plus, they're on medications that make them constipated. These people worry about going to the bathroom. And you'll make a call, and the chief complaint will be, I haven't been in the bathroom in a week. They don't want to go to the doctor, so they'll use you to give them some information. Why don't they want to go to the doctor? The big C word. Yeah, they're afraid of the big C word, and they just don't want to hear that. This is a good time to do a bowel sound assessment. We don't really do those in the pre-hospital world, but on these patients, I think it's warranted. Stethoscope, listen to bowel sounds. Mine are hyperactive. I'm sorry. Can't help it. You may have heard it. Mine are hyperactive. You can certainly have heard them last night. The fluid shift, we're getting ready to evacuate the E. coli that is in your intestine. Huh?
You should repeat it because he missed it.
Yeah, I was near a toilet, but I heard it before the toilet. I'm glad I was alone. I'm glad no one was at home. That would be hyperactive bowel sounds. When you're listening to bowel sounds, you should hear some digestion mobility about, say a sound every 1 to 3 minutes. Hyperactive, it's rumbling, it's pretty continuous. Hypoactive or absent, if you listen to someone's gut for 15 minutes and don't hear a sound, there's nothing happening. So it's all backing up. It'll back up to the point where it's causing pain. That's usually why they call you. It could back up to the point to where the stool is now back in the stomach, and they may vomit that stool, and that's nasty. That's very nasty. They'll go oftentimes and they'll have their cancer removed, which requires the removal of the colon, and now they have a colostomy. So let me tell you 2 different kinds of bags, or really 3 kinds of bags. There's one called a urostomy. It's a bag that you pee into. So it doesn't come out the penis, it doesn't come out the urethra, it goes into a bag. And people who wear that bag have to go empty it periodically. There is a colonoscopy, or a colostomy. A colostomy is a bag that's attached because you don't have a colon anymore. And the colon is the latter portion of the large intestine. So the large intestine dumps into the bag. I'll just be frank with you. Frank not in the name, but frank as in obvious. They're nasty. They smell like a smell you've never smelled before. And when these patients fall in a nursing home and that bag gets detached or ruptures, oh God, that's an old Brandon's in the bushes vomiting, and I'll vomit all the way to the hospital. I can't take it.
Oh yeah, that one's worse. C. diff smells worse.
C. diff and a colostomy. I got one better. How about C. diff and a colostomy? That's just rancid. It is a smell. If you can stomach that, I'll give you the gold star and buy your lunch. I mean, I don't know how you do it. I will vomit repeatedly all the way. I can't get over it.
There's this dude that lives around here. He drives in a single cab, like Toyota Tacoma old truck, or a Ford Ranger, one of the two. And he always comes up. He has diabetes, real big deal, with colostomy. He always has C. diff. And he'll sit in his truck for a month before he starts defecating all over himself because he can't move. And we have like pick him up, but the problem is you can't pick him up by his legs because I did, and because he has like all those wounds on his leg from like diabetes and stuff.
And just setting.
His entire when I tried picking his leg up out of the truck, my hand slid up the back of his leg, and his skin and everything followed my hands. And it was just
How can the human body is so tough. How it can continue to do that.
He was an asshole too. Like I did not like that guy. He was so mean. I was like, bro, I'll leave you in this truck. Like, I don't
You made this choice, yeah. The other bag is ileostomy. Now it connects to the small intestine, and they don't tend to smell as bad. Blaine wouldn't. Blaine, if you take Blaine's class, you will learn that he has an ileostomy. He's not ashamed of it. He's proud of it. He said it saved my life. He had a real bad case of Crohn's, diverticulitis, irritable bowel, one of those things. He had to have his entire large intestine removed. And so he wears that bag. Now those don't smell because it hasn't went into that deeper process yet. I mean, there would be a little odor to it. And he'll tell you, if you, please tell me if I'm leaking or smell, but he lives with it and he lives comfortably with it and does very well with it. So he. So be aware of those as they go out. Now your world and your job is not necessarily to change those bags or do anything else, but you can facilitate a change if they need some help. Okay. Any others? And I know we're just trying to push through and be done by 11. AAA, I was way deep into paramedic career before I realized that was an abbreviation for abdominal aortic aneurysm. That's what I always called it. And every time somebody'd say AAA, I'm like, is that a car insurance thing or something? It's pretty common. You know what that looks like. I hope you do by now. There'll be a pulsating mass in the abdomen. So when they're lying flat, you'll see that pulse. And in the abdomen, don't press on it. Urgently transport before it ruptures and they die. But it's very, very common. It says it's extremely difficult to assess in the pre-hospital setting. They are correct until it's about ready to rupture, and then you'll really start seeing it bounce. Usually there will be a complaint of my stomach hurts. I just got this tearing sensation in my back. I think I hurt my back. And they'll go in, they'll do a scan of the belly, and they'll see the aneurysm. Once it balloons out into that ladder or that outer shell of the aorta, that's when it really starts bouncing and bumping. So if it ruptures, they will die. Now, some of them can rupture slightly, and it may take 2 or 3 days for them to die, but it happens. Kidney shutdown, primary reason is diabetes. Men with prostate glands get a condition called benign prostatic hypertrophy. So Gus knows what hypertrophy is now. Gus has a prostate gland, I'm pretty sure. When that prostate gland gets bigger than it should, the urethra, or the tube the urine goes through, gets constricted by that gland. And these men have a really hard time going to the bathroom, urinating. They take medications, usually alpha-1 blockers. And alpha-1 blockers reduce the size of that. They might take Cialis, which is typically an ED med, but they take it here in this case because Cialis reduces the size of the prostate. It can get so large that it completely shuts off the urinary flow. The urine will back up into the kidneys. The urinary bladder will be distended. They'll get UTIs, get infection, and they'll start smelling like urine. But it just depends on how well they're able to take care of it. There are some men who will catheterize themselves every time they go to the bathroom. This is not prostate cancer. This is just a swelling of the prostate, and it starts occurring about 40. When you talk about prostate cancer, the rule says that men will die with prostate cancer, not many will die because of prostate cancer. So once you get past about 40, if you look for cancer, it'll be there. But is it confined to the prostate or not? What that means for the EMT is you will probably make calls on post-surgical prostate procedures. Bleeding, inability to void the bladder, issues that occur in men after they have their prostate surgery. I took a man to the hospital, to the radiation treatment center for a month to treat his prostate cancer with radiation. I didn't know how they did that until I saw it. So the first day I took him was for get him ready for his radiation treatment. And they put him in stirrups, they laid him back, the lights were off in the room, and they had a focused target on his perineum. They taped his genitals back out of the way, and he's lying there with his business exposed to this light that had a target. It's like looking through a rifle target, and it was putting that on his perineum. They were targeting the prostate, and where they were targeting the tumor. And here come this needle out of this machine going, and it goes into his perineum, and when it hit his perineum, now they had numbed him and sedated him, but he was like, I was like, oh God, I'm gonna pass out. Do I have to be in here? And they're like, if he falls, you need to be here. I said, what are y'all doing? They're like, that's the cannula that's going to drop the radiation pellet in him. So they were putting that hollow needle in there to leave a radiation pellet and then pull the needle out. And they put a tattoo there for the scope so they know where to focus this beam tomorrow. And I took him to the cancer center. I worked days. I worked what we called a day truck for transfer service, basically. And I would go get him every day for his radiation treatment. And we put him in those stirrups every day. Now the needle only came out the first day. The second day it was just like a beam of radioactivity, and we take him back. Didn't take a minute, if that. And I took him home to Atoka to die. It just burned him up on the insides, totally burned him up. And on the way to Atoka, his intestines turned loose. And he knew it. He was conscious. He was talking to me. He knew he was going to go home to die. We're like, oh, I live in Oklahoma too. Yeah, I live on the farm outside of Atoka. You guys, you'll know when you get there because you'll see the blah, blah, blah. But he had turned loose. And I was making an adult diaper out of sheets trying to get this cleaned up. And it was just horrible. And we'd take him into his house in that condition. Thank God there's now hospice. That was kind of pre-hospice. So thank God there's hospice now. Dying with dignity. He did not die with dignity. He died embarrassed and in pain. So you will die with prostate cancer. You may not die because of prostate cancer. Keep your prostate healthy. We'll talk about that after class if you want to know how. When you go into these homes, you're going to smell the urine on the floor. Luke, yes, it's just bad. They can't get up, so they'll just roll over and pee in the floor. If they're a man, if they're a woman, they just may pee in bed. Urinary tract infections, yeast infections, vaginosis. You pull the sheets back and there's a pile of cottage cheese between the legs. That's discharge from the yeast infection that she has. Do y'all know that sexually transmitted diseases are the most prevalent in nursing homes right now? And there's some science that says COVID's probably the reason for that, because nobody could come in and couldn't leave. And I've asked nursing home, you've worked in one, is like, does that go on in there? Like, oh yeah, it goes on there. We don't encourage it, but we just don't go in there sometimes either.
There was an old man who would literally put a sock on his door. And if you saw that sock there, you don't go in there. I
had a student sits back there where Grady's sitting right now last semester, and she worked in a long-term care facility / nursing home. And Mr. Mike, well, just leave him like that, he got to shower 3 times a week. and he utilized his entire time. And that's what he was doing in there.
Don't blame him.
Yep. 3 times a week. He kept saying, I'm going to need some help in here. And she's like, you don't need any help. You don't need any help. You don't think old people do that, but they do. They do, okay? They do. But back to the grossness of it, they'll just sit and poop in bed. They'll urinate in bed. If they cough up blood, they'll spit it in the floor. I've stepped on carpet and it's like, what is that? And like, oh, he's dying of lung cancer and he's just been spitting in the floor. You're like, yeah, that's oozing out of the carpet.
Throw these away.
It's oozing out of the carpet. I wonder why I got naked before I went in the house after shift change when I went home, right? I live rural, I could do that. I was like, don't touch those clothes. Do not touch those shoes. Don't bring the shoes around so your little crawling toddler can get a hold of them. Just disgusting. Disgusting. I've seen mattresses where diarrhea was oozing out of the vent holes. I don't know if you know what a vent hole is in a mattress. I don't see that too much anymore, but the little metal vents that are sewn into the edges of a mattress, I've seen diarrhea oozing out of those. And just this man laying there for, I don't know how long he laid there, but long enough to have a lot of diarrhea. Yeah, Luke. Yeah. Welcome. Glad you took the class. Doesn't mean you have to take the job. Get your certification and do something else. No, do what?
You should just go to those houses with your SCBA.
Oh, there are times you can do that for sure. If you have that capability, don't have a problem with it at all. Don't have a problem with that at all. Okay, endocrine system, yeah, endocrine, diabetes, antidiuretic hormone, getting up in the middle of the night, blah, 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 all that stuff. So we know about that already. You know what it looks like to have your glucose either too high or too low. So that goes along with it. We talked about the joints. We talked about the muscle decline, osteoporosis, sarcopenia. Am I using the right word here? I believe so. Loss of muscle due to aging, sarcopenia. So as you age, you really want to be lifting heavy weights as long as you can lift heavy weights. People get mad at me because I let my mother mow her yard with a push mower. Rake leaves. Your mom's old. She don't need to be. No, she does need to be doing that. Is it risky? Yeah, it's risky. Is it risky not doing anything? More risky. She's delaying sarcopenia. It's going to happen anyway. After 40, about 10% a year.
How do you spell that?
Sarcopenia, I think it's SARCOPENIA. Try that and see if it'll autocorrect, because I'm sure I butchered that. Did I get it? No Alzheimer's yet. Do what?
I work with this 91. I work at Walmart, and yeah,
He's ripped?
no, he's not dying though.
Oh, he's still going at 91. Yeah, I get what you're saying. If you don't have a purpose and you don't work, you will turn into the guy in the bed with diarrhea running out the vents. I truly believe that. You got to have a purpose. You see so many people around my age, a little bit older, retire. And what are you going to do? I'm not going to do a damn thing. Well, you'll die in 5 years. Remember that first pie chart I put up? That last 15 years of life was compromised? That's the person who retired. The insurance companies and the actuaries and the Social Security count on it.
Frank,
Financially
I'm warning
stable.
John, warning you right now. Whatever he's watching on his phone, he don't watch.
He's that kind of old guy too, huh?
He's fine.
All right.
Yeah, I said it.
Let me talk to you about something you will encounter quite frequently, and that is the ulcer development on the skin, the decubitus ulcers. It doesn't take but just a few, I say a few minutes, it takes longer than a few minutes, but 45 minutes, you can have the early stages of ulcer development going on. 4 days, not rolling over in the bed, not turning, sitting in a wheelchair, and that's all you do is sit in this chair and you don't get up and you're not mobile. You press the blood away from the capillary bed and that tissue will start to die and it ends up looking like this. You will take a lot of patients to the hospital to get what we call debridement, D-E-B-R-E-I-D, debridement. Did I spell that wrong? I before E except after C? Sorry. Debridement. Debridement a fancy word for cutting away the dead tissue. If you ever get the call that says you need to take so-and-so over to Medical City Hospital for debridement, that's what's happening. The decubitus ulcer has gotten so bad that they're going to go in and get it cut out. Once it's opened up, it could be infectious, obviously. This is where our diseases like MRSA, staph infections set up, and they don't heal. Be sure you wear proper PPE yourself, staph precautions, which you should anywhere in a nursing home. Staph is rampant in nursing homes. C. diff is rampant in nursing homes. Tuberculosis is rampant in nursing homes. STDs, rampant in nursing homes. UTIs, rampant in nursing homes. It's an infectious place to be. It's an infectious place to be. I don't necessarily think you need to know all the stages. Just realize that these ulcers can get so bad that you're actually down into the bone now. And you may pull the sheets back on someone and see their tailbone. See their hip bone, their femur. See their ankle bone or the back of their heel because they've been lying in bed. The back of their head. These are serious wounds, and they're common here. There's the polypharmacy stuff. It becomes toxic because the liver can't work anymore, and it builds up because the liver used to get rid of all the toxins, now it can't. So there's the word polypharmacy. So it starts, like it does in all these slides, it tends to repeat itself. We've already talked about a lot of this. This is posted, so please go through it and look at it yourself, and I know you've all read the chapter. Do we have any questions in the last 10 minutes? Now, Amber passed out, I should have paused for it. If you haven't signed the form that says that the handbook's been updated, and you're acknowledging that, I need you to sign that, and Amber has the blank copies. If you have signed the form, thank you very much. It really doesn't apply to the EMT, but it will apply to the admission process to go into paramedic school and stuff. So it's been updated, and we just want you to know when those updates occur. Now, any questions? Tomorrow is your last lab day, but I need you here tomorrow because we're going to do some new labs. These are labs you haven't done yet. The number one thing you have to do tomorrow is childbirth.
Delivering a baby.
We'll deliver a baby tomorrow.
What I've been waiting on.
So that's the last lab. That does not mean it's the last Thursday. We'll use those Thursdays for review and test and stuff. I will see you in the morning.